Hello, everybody. Good morning or good afternoon, depending on where you're joining from. It is morning for me from sunny but distant foggy San Francisco. The sun is out today. Depending on my blinds and where the sun shines, I might even get a ray across my face or something as we're going through this. Nonetheless, I am very excited to be here with all of you guys today. A number of you are still trickling in, so I'll let you guys get started or get sorted rather, but we're going to get started really quickly because this is the shortest of the sessions today. So I am going to zoom through everything. I am really excited to be opening the floor for the Open Enrollment Summit. This is actually something that we started at Caribou. This will be the third year. We did it 2 years ago. We started it. We did it last year. And now under the Move Health brand, it is bigger and better with more sessions, speakers, more attendees, which is amazing to see. We've got hundreds of advisors joining us throughout the day, which we're really excited about. And so without further ado, we're going to get started with the first session. And this session is going to be all about why you, as a financial advisor, assuming that those who joined are financial advisors, why you should care about open enrollment. And that means open enrollment for both Medicare as well as for the marketplace. So we're going to be jumping back and forth just between the two, but there are dedicated sessions to both topics later today as well, and I'll make sure you have the agenda for those too. So I already mentioned Caribou just briefly. In case you don't know me, in case we've never met one-on-one, I was the founder and CEO of that company. I am now a partner at Move Health after the acquisition of Caribou in January. So it's been a very fast and furious, but fun, 3 Fs, last 9 or so months. If I am not at work talking about healthcare planning, meeting advisors at conferences, I am doing pretty stereotypical San Francisco things, like swimming in the bay, doing yoga. I recently took up golf. It's a very humbling sport. If you are ever in the Bay Area, give me a shout. I'd love to meet advisors here. We've got a good local group of advisors here as well that I just absolutely love seeing. But now what you guys all came here for, why you as an advisor should care about open enrollment. There's some data that I want to share with you first. And really, we're going to go through the why really quickly because it's, at least to me, pretty obvious why you as an advisor should care about open enrollment. We all know, based on the probably at least 5 or so years, the talk of holistic wealth management, financial planning, tax planning, estate planning, all these other sorts of services that clients are expecting. Hopefully everyone here knows that clients want more than just investment management. Actually, in a recent survey, 40% of respondents reported that they're looking for insurance advice specifically as a product or service beyond core investment management. What's really interesting, I could show you like slide after slide after slide of all the data that supports this. But what's most interesting to me that I actually don't have on a slide is that high net worth clients expect this more than more mass affluent clients. Maybe those who are investing million, 2 million, 5 million might not actually expect that as much as someone who's investing $10 million, $15 million, $20 million with you potentially. Those high net worth, ultra high net worth clients really do expect more of that family office type of feel where they're getting all sorts of different products and services, including insurance advice. Now, insurance advice is obviously a little bit broad. You can have multiple forms of insurance. And so that's where, to get a little bit more granular, I wanted to share with you guys that 65% of clients expect health insurance advice specifically. Now, what's most alarming of this graph here is that a very, very small fraction of that 65% actually receive that advice from their advisor. So if we're looking to exceed client expectations, let alone meet client expectations, it appears that we are not, unfortunately, meeting client expectations in this area. If we're looking to exceed client expectations, luckily you have come to the right place today. So for this session, we're going to keep things probably a little bit more high level. We're going to dive into some specifics, but you really want to attend the sessions later today to get more granular on both topics for Medicare and the marketplace. Let me share a little bit more in terms of the why behind why this is so important. 90% of Medicare beneficiaries don't revise their drug plans annually, and 95% of them are on a drug plan that's not optimized to their current prescription list. This means that your clients are overspending on maybe the plan itself or their medications or both. That means that if they have a new diagnosis, a new prescription, or maybe they're off medications that they're used to take, but they're not taking anymore. That means that in those cases, they could be overspending drastically and don't have the appropriate coverage for their needs. So health insurance is very much not a set it and forget it type of thing. It is more of this, like my investment strategy, like my financial plan. I need to review this at least every single year, and open enrollment is the perfect time to do that. Today's Wednesday, but on average Tuesday, I meet and talk to advisors every single day. And oftentimes I will ask them the question, very simple question, of how often does health insurance come up in your client conversations? And I will usually, not always, get the response, not that often, maybe a couple times a month. I know maybe like 10 or so clients a year ask me questions about health insurance. And I'll follow up that question or that response with another question that is, how many clients do you have that are retired and over the age of 65? And in a lot of cases, I will get a response of hundreds, depending on the size of the firm, of course. But even for small firms, I'll get a couple dozen clients, 50 clients. In the event it's a large national firm, hundreds to thousands of clients are going to be on Medicare. And that is where I will then hit my forehead internally, not externally. I'm not going to do that in front of an advisor. My goal is to educate the advisor on how they can take advantage of that opportunity, how they can see that as an opportunity to build stronger connections with their clients, help them with more planning, and ensure that their clients are getting advice from a trusted source. So hopefully you've come here today with the desire to want to do more for your clients, or maybe you're already doing a lot when it comes to healthcare planning for your clients, and you're just looking to refine some of your tidbits of knowledge that you already have. But if you are brand new to this, please don't let this seem overwhelming or scary. There are lots of resources, including us as a company, Move Health, that can assist you in delivering this service offering very effectively and efficiently, meaning our goal is not to take up your time. Because oftentimes the response that I get back, after I try to educate an advisor around what the why behind why you should be hopefully educating your clients on healthcare planning, is that I just don't have the time, or I just don't have, the education or the insight, and I don't want to learn, which I think is completely fair. We're not trying to convince you to be, a health insurance expert, but this means your clients are getting advice from someone else. They're getting advice maybe from their neighbor, from another insurance broker, from a friend, from a family member, from potentially another licensed advisor, maybe not their direct, financial advisor, but maybe they have other insurance products that get sold, annuities, and this could pose a risk on your relationship with your client, but also the quality of the advice that the client receives. So those are the two really, really big risks that you unfortunately succumb to if you're not the ones, guiding your clients through this area of their financial planning. So there's no CE for this session, but I was hoping to make it a little bit interactive. This is not an actual quiz or anything. So if you're, attentively listening and on your keyboard, I see some people already typing into the chat some questions. If you were comparing, traditional Medicare to Medicare Advantage side by side, and you're just looking strictly at the cost here, take a second and digest this. The brief is just that it's outlining Part A, Part B, Medigap, and Part D to a Medicare Advantage plan. What is not pictured? If you're just looking like strictly at cost, there's a bunch of you in here. I'm hoping at least a few of you can shoot me a response or something to show me that you guys are attentively listening, or maybe you don't know, and that's okay. But I'm gonna wait maybe just 10 more seconds and see if someone says the coverage isn't the same. It's true, but how? How isn't it the same? Prescription costs. Yep, that's a good one. Total financial risk, yeah, those amounts are different. I actually priced this out specifically to show you that they can come out to be like similar to each other. Um, no rehab after catastrophic hospitalization on Advantage. Okay, we're getting really specific now. The out-of-pocket costs, yes. The network, yes. Okay, we're waking up. I love this. So you guys know some differences then between traditional Medicare and Medicare Advantage. And what sometimes is overemphasized, especially on commercials, or if you're speaking to a broker really quickly and they're just maybe trying to advocate for cost savings, is there's a lot in here that's not necessarily super obvious to someone who isn't an expert in Medicare. One of them being, prescription costs. What's the difference between the Advantage plan and Part D as a standalone? Another being the network of doctors you could see. That's a really good one. Ability to change coverage in future years. Yes, that one is super, super important. With Medicare Advantage, you can switch every year, but with traditional Medicare, that supplement, you're pretty much married to it for life unless you can pass medical underwriting. What nuances for former federal employees? Yes, that's a very, very detailed question and response. So we're not going to dive into that today. But if you did have some other form of benefit that's acting alongside Medicare, then that can get very nuanced as well. These are all really good answers. So now if I switch over to this one, this is a snapshot of our health planning analysis that we do for clients. And this is the marketplace. So this is if you're under 65. And similarly, you can see here just the cost outline. Premiums, in this case, it's $0. It's a fictitious case, unless you had a premium tax credit that's covering your entire premium. But you also have an out-of-pocket maximum here of $0. So this is not real. But you can see here co-pays. But what's not shown is a lot of what we already mentioned. The networks, what doctors you can see, the prescription drug costs, and things like that. So if you were just strictly looking at costs, which tend to be the way that these plans tend to be marketed. I don't know if any of you guys are, football fans, but there was that Joe Namath commercial, a few years ago. There's so many commercials that come up throughout the fall months that are very enticing to people who don't understand Medicare well. And what is not pictured when you're just strictly looking at costs is going to be provider networks, drug formularies, drug costs, potential rate increases. Some carriers are known to hike rates, higher than others. The carrier stability, meaning, is this a reputable carrier that's been in the market for a very long time? HSA eligibility also wasn't pictured on that prior screenshot. That is not relevant to the Medicare world, but very important for the marketplace one. And out-of-pocket maximums or deductibles typically are not something that's, marketed. Got a quick question in the chat. Isn't the expiration of the ACA tax credits a big deal now and a big opportunity? Yes, I love the way you phrase that question. Isn't it both a big deal and a big opportunity? Yes, I would highly suggest you attend the next session. I'm going to touch on that in a little bit, David, but I'm not actually going to go into too much detail because we're going to cover it at length later on. But let me get back to you on that one. So just to wrap up this short little point that I'm trying to drive home is that, again, if your clients are getting this advice from somewhere else, they might not see the full picture that, a trusted resource or even you, if you wanted to take the time to go through it with your clients, could provide to them. So this is where you get out your pen and paper. I think these dates should be reiterated throughout the day, but I wanted to make sure that you had them here at the onset. For Medicare specifically, the annual enrollment period is October 15th to December 7th. And what's really important to know is that during this time, you can change from original Medicare to a Medicare Advantage plan. You can also do the reverse, but as we already covered, you'd have to go through medical underwriting to get approved for that supplemental plan. You can switch your Medicare Advantage plan, no questions asked. You can switch back and forth. You can switch from an Advantage plan that doesn't offer drug coverage to one that does. If you haven't had it, you would be exposed to a late enrollment penalty unless you had credible coverage from another source, though. And then you can join, switch, or drop a Medicare drug plan. So from October 15th to December 7th, given the community that we serve, being financial advisors, many of our clients are enrolled in traditional Medicare. And so the most important thing to know is that last point, you can switch your drug plan during this time of the year. But we have plenty of clients who are also on Advantage plans, and you can also switch your Advantage plan during this time too. To complicate things, because it's health insurance and why not, there is also a second time of the year. There actually have two separate names and you can do two different things during these two periods, but they run at the same time. So during Q1, January 1st to March 31st, is both the Medicare Advantage open enrollment period and what's called general open enrollment. And the difference between those two is that one, you're on Medicare Advantage plan, you have an extended time period to be able to review your coverage and change your plan if you want. And the second one is if you missed your initial enrollment period when you were first eligible for Medicare. This is the only time of the year where you can actually pick up a supplemental plan and go through medical underwriting or pick up a Part D drug plan and be exposed potentially to a late enrollment penalty. So everything you can do is listed here that I just went through. And then what you can't do though is you cannot make that switch to your drug plan during this time of year if you've already been enrolled in Medicare. So that's a really important distinction. For the most part, many of your clients, this is what's going to be important to them. There are exceptions where this is also relevant to them. But for the most part, you want to be considering that October 15th to December 7th as your time to really reach out to clients and ensure they're modifying their Medicare coverage. Who you're going to focus on is going to be, for the most part, if you are kind of our average advisor that we work with, it's mostly going to be those clients reviewing their Part D drug plans. But you are going to have those clients who are also on an Advantage plan and need to review their coverage too. There are some circumstances where clients have what's called guaranteed issue rights, meaning they can switch their Medigap policy more easily than other clients can, and that's depending on their location. So some states, Connecticut, Maine, Massachusetts, and New York, have what's called guaranteed issue rights. You can change your supplemental policy actually any time of the year, but it's just a nice reminder that, if your client for some reason is unhappy with their supplement, this is the time of year where they could do that too. If they are not in one of these states and they want to change their supplemental policy and we think that they'll pass through medical underwriting, we can also do that as well. Any client that has had any, recent changes to their health, where they live, their income, definitely reach out to those clients, although you should really be reaching out to everybody. It is really easy to target this audience because of the age. We'll get there in a little bit. But there, to me, is no reason why, as an advisor, you can't quickly scan your CRM, send an email, offer some assistance in supporting your clients with their Medicare coverage. Now, for your clients who are under 65, it's a lot more simple. November 1st to January 15th, although if they do want that coverage in place January 1st, it's December 15th. And this is for clients who are on the marketplace. You don't have to worry about different pieces and parts of Medicare. It's a lot more simple. What you can do is you can enroll in or change your entire health plan. And by enroll in, I mean maybe you are not covered by insurance today. Maybe you have COBRA coverage perhaps, or maybe you have some short-term plan, or maybe hopefully not, you're uninsured. You can pick up a plan. It will become effective January 1st. Or if you are already on the marketplace, you can change that plan. If you are a client and the marketplace is, and you're on the marketplace, who you want to be reaching out to as an advisor is going to be those pre-65 retirees, potentially small business owners who don't have a group plan, your clients' children who are hopefully, growing up, aging off their parents' policy. Maybe they live in a different state. Maybe they're not even yet 26, but they live elsewhere or are fully independent. It's a great opportunity to build that connection with the next generation. Any client who's on COBRA, as I mentioned, people initially enroll in COBRA when they retire because it's like the easy button thing to do. I'm just going to continue my coverage that I'm familiar with. It's probably a lot more expensive than the marketplace, but I've got so much going on with my retirement. I'm just going to enroll. If that's the case, or if they'd already met their deductible for the year, then definitely we want to be looking at potentially switching off that coverage effective January 1st when their deductible resets. It gives the client a good opportunity to get still great quality coverage. It might be a little bit different than what they're used to. We'll verify their provider network and all of that stuff, but hopefully the cost is actually a lot lower. Any client as well with those changes to their health, medication, where they live, their income, any client interested in exploring HSA compatible plans, those high deductible health plans, there's some good changes coming to those too that we're going to cover in the next session as well. More plans are going to be HSA eligible. And anyone who is currently accessing a premium tax credit. So to the question in the chat earlier, big deal, big opportunity. Both of those things are true when it comes to premium tax credits. Please attend or register and get the recording for the session that follows, what financial advisors need to know about ACA Marketplace Open Enrollment. It's 15 minutes after this one ends, so it starts in 25 minutes. And these are huge changes due to the One Big Beautiful Bill Act. They are, I'm not going to spoil the surprise, although I doubt it's a surprise, hopefully, to anyone anymore. But a lot of these premium tax credits are going to get reduced for clients and potentially go away for clients depending on their income. So the opportunity that you have as an advisor is income management and working with your clients to potentially maximize that premium tax credit. We will cover, later sessions, scenarios where clients are, doubling, tripling their healthcare expense in comparison to prior years because of those tax credits. So I cannot stress that importance enough. So in the last 10 minutes here, what I want to cover is, I've told you why it's important. I've told you some dates on when you need to take action. And now I just want to cover how you can actually take action. In the later sessions, they're going to get a lot more granular, more like education based. My goal today is to encourage you to have the confidence to reach out to your clients and take action with just like a little bit of marketing support. Okay. We are always happy to help you with your marketing strategy. I am really just going to be scratching the surface with these next few slides. So if you have any questions or thoughts after you go through these slides, please reach out. I would love to brainstorm with you and help you with your marketing strategy. What we recommend, typically, I attended a really, really great conference a couple months ago, the Jolt conference. It's all marketing focused for financial advisors. And I listened to this amazing session where the speaker described the 3 most important adjectives for your marketing strategy are relevant, specific, and different. And in some ways, these words kind of all sound the same, but the nuance between them is really important. If you get an email, if you're like in your 30s and you get an email from your advisor about Medicare, you're hitting delete, you're not even opening it, you see it in the subject line, you're thinking, what is my advisor even doing? That's not relevant to me. They're just hitting me with mass marketing. Second, if you're being specific, you're telling your clients exactly why this is important to them and exactly what they need to do. Last, if you're being different, you're doing something that other advisors are not doing, and this is one of them. As you saw in those earlier graphs, 4% of clients are receiving healthcare planning. Maybe that's grown. I think in the T3 survey last year it was up to 5%. Probably though still it's under 10%. This is still something super, super different that you can do to really differentiate yourself in the market. So what you can do is, the time is now. That's why we covered the timelines in this really important meeting, or in this important presentation. I wanted to cover the timelines because this is going to dictate your marketing strategy. Medicare open enrollment goes until December 7th. Marketplace goes until January 15th in most states. My tip to you is do everything in November, meaning we're already mid-September. The marketing strategy starts yesterday in some cases, if not tomorrow or Monday. Okay, so we've got 5 weeks until, maybe a little bit less, maybe 4 weeks until open enrollment starts. For Medicare, you've got about 6 weeks into the marketplace. This is your time to hit clients with probably 3-4 different communications. And what you want to do is you want to use your CRM and identify those clients who are on Medicare, the marketplace, they're self-employed or on COBRA or any dependents, even anyone who's 26 plus and doesn't have employer coverage. This is really who you want to be targeting. And for Medicare, it's really, really simple. You can create, this is a screenshot of Redtail, which many of you probably use, but even if you're using Salesforce or Wealthbox or any other CRM, HubSpot, I don't know, so many that advisors use. You can create these really easy birthday lists, or 65 plus or Medicare clients, call it what you wish. Old farts, I don't know, don't use that one. But I can help you do this in probably under a minute if you'd like, and we're always happy to support you with that. You can create this list. You can reach out to this client list 2, 3, 4 times just to make sure they know that you are there to support them with their Medicare coverage. So create workflows, make sure that in your CRM, maybe you're tracking coverage type. For Medicare, it's really easy because of the age, but for younger clients, you probably want to have some form of a drop-down menu of where they get their insurance, and Marketplace being one of them. If you're not doing that today, don't worry about it. You can always start now and still send out emails to your clients who, maybe you're hand selecting who those clients are that are retired. Try to ditch those mass emails. Like I just said, we want to be relevant and we want to be really specific. So it's really hard to do that if you're sending the same email to your entire client base. You want to customize the outreach for Medicare in the Marketplace if possible. If these are things that are beyond your bandwidth, reaching out to them altogether is better than not reaching out to them at all. And also use this as an opportunity for growth. So this doesn't have to be just dedicated to your clients. You can extend the offering to family members, to friends, to parents, to neighbors, to coworkers, to whomever. An advisor once told me, I was at Thanksgiving dinner and all anyone was talking about was their Medicare coverage. This is so, so true. So, make sure that your clients know that they can also potentially extend this to their friends or their network, and then that could introduce you to your next client. I would not try to give you more work unless I was going to try to make it as easy as possible for you, okay? So I'm going to give you here a full email that you can use, and these slides are going to be available. This recording is going to be available, but you can also screenshot this slide if you would like. So one subject line that you could use, it's specific, it's kind of boring. Maybe you could throw an emoji in there. Talk to your advisor about open enrollment. Specific, you're giving the client an action. Client's name is George. Hey, George, it's that time of year again. It's open enrollment. Every year, health insurance plans change and can have a possible impact on your premiums, your in-network doctors, your pharmacies, your prescription drug costs, and more. Plus, your household needs and financial situation may also change from one year to the next. This highlighted part is telling the client how it impacts them. Next, conducting an annual health planning analysis with our trusted partners at Move Health, or insert how you address that directly with your clients. During open enrollment can help assess the best course of action for you. That's your offering. That's what you're giving to the client. Now, this looks like a lot, but you would pick either the left or the right option. Give them the timelines. Medicare open enrollment is from October 15th to December 7th, or Marketplace open enrollment is from November 1st to January 15th. And then tell them how to take action. Not going to read the full thing out, but reach out to your advisor so they can set you up with an account, or reach out to me and we'll schedule a call. Whatever your call to action is, your CTA, make sure that's included so that clients know to reply and know how to take action. And then I know as an advisor, there's lots of encouragement out there to produce content, whether it's blogs, videos, LinkedIn posts, things like that. We have a lot of things that you could potentially just attach to this as a free resource as well. So make sure you give a little to clients or prospects always. This can, of course, go out to both audiences. Give them a little something, get them excited, give them a resource. If you don't have one, we've got lots that you can potentially repurpose. All of our partners get access to our Learn Center. There are videos like this one of one of our founders, Cole. You could take one of our blogs or newsletters. We write guest articles for different publications as well. You could include those just to give clients a little bit of more insight into why this period is super, super important. So I can't stress enough how, content is going to also really help you. That being said, I do not want to make it seem like you have to do so much to be able to really launch a healthcare planning offering, because we do offer a lot of this. The only other thing that I want to make sure I stress is that you can use this with prospecting clients. You can give this away for free. It does not cost you anything extra. It does not take up any extra of your time. And so please, please use this for growth. We've had such great success with the advisors that we work with using this for growth purposes and closing clients. So I've got 1 minute left. I don't see any other questions that have popped into, I do see some questions that have popped into the chat. Okay, before I try to adjust those in a speed way, what you're looking at here is our health planning analysis. There's a lot of detail that goes into this, so I'm not going to address it all, but we can essentially do the entire analysis of your client's health plans for you, for your clients. You can hand it off to us. You can be an active participant in the process. It's really up to you. There are other options of learning it all yourself, would take a lot of time. Referring clients to someone that you trust, maybe locally, although there are some trade-offs and limitation to those options. Usually, the variability of plan options that they potentially have access to, as well as capacity and security. And there are some local ship programs as well. They also have those same limitations. They don't necessarily have the product or the carrier knowledge that someone like in our position would have. And so we do believe that we combine like the best of the hand-holding boutique experience where your client gets to talk to a human, but also powering that with technology that allows us to efficiently handle, thousands of clients over open enrollment and keep you in the loop and ensure that your financial plans are updated as well. So something to consider as you are going through the rest of the sessions today. I am already 1 minute over. There is a question about HIPAA. We are HIPAA compliant. That's a really easy one to answer. Didi, reach out to me after if you want to learn a little bit more about that. And then there was just some reinforcement on how important it is to maintain a list of prescriptions for clients. It's frustrating to Al that you can't potentially incorporate that into your CRM, but that's what you would gain through a platform like ours. So if you're not working with us, definitely reach out to learn a little bit more about that. So I've taken up a couple extra minutes of your time. I spoke really fast during this. Watch the recording if you need to. Reach out to me if you have questions. Otherwise, get a coffee, go to the restroom, stand up, stretch your legs, and come back in 13 minutes for a session with Drew, one of our founders. He's going to cover what you need to know specifically about the marketplace, which is that big deal and big opportunity. I might steal that one from you, David, okay? So definitely tune into that. It was an absolute pleasure. Thank you guys so much for tuning in and enjoy the rest of your day.